Your body goes through a lot during pregnancy, and it may need a little help recovering afterwards.
And that's okay. We're here for you. We invited Emily Pastrana with Empowering You Physical Therapy and Pelvic Health to share more about postpartum care. And I feel like postpartum care is, I don't want to say getting worse, but I feel like our knowledge of it is getting worse because after 2 kids, I still don't know what I was supposed to do. Why do you think that is?
I think what's happened in one of my biggest soapboxes I get on is the phrase common, not normal. And what's happened is we've normalized all these dysfunctions, right? So like leaking when we cough, sneeze, and laugh.
Oh gosh, every time.
Every time.
It's not the first or second sneeze, it's the third one that gets me.
It'll get you. It's the hardest sneeze.
Telling you.
It'll get you.
Yeah.
The weakness in the core, some pelvic pain, all of these things we've just kind of chalked up to motherhood.
Yeah. Right.
Oh, I'm a mom. That'll happen to me now. And that's unacceptable. So we say it's common. It's not normal. There's help for all of this. You don't have to pee yourself forever is another one of my slogans.
Okay.
Put that on a shirt.
So can we talk about some of the conditions? Because we were talking about this earlier. You go through 9 months of seeing the doctor once a month, then once every 2 weeks, and then once a week, and then the baby starts to see the doctor once a month after that for the first year. We get that 1 6-month check-in or 6-week check-in to see how we're doing. Outside of that, we're not really being checked on. So what are some things that we should be looking out for, some common conditions that aren't normal?
Great question, yes. So the one we hear about the most is a leaking, like you said. So any incontinence or leaking of your bowel or bladder, both, that's not normal.
No.
Right? And then a really big one is diastasis or diastasis, you can say it either way, recti, which is just that ab separation that a lot of us experience. We all experience it while we're pregnant. But then once we're in that like 6 weeks plus postpartum, if you're still having a separation there, that's not normal.
It's not normal.
It's common.
Yeah.
I also thought, and I've already, like I said, I've been pregnant twice. I thought that you could only have diastasis recti if you had a C-section.
False.
Look at that. We are debunking.
It's fact checking.
We are.
It's the expansion. I mean, your belly is growing, and so everything kind of expands and widens.
Exactly. Everything.
Yeah.
So when we're pregnant, 100% of us grow and expand, and our tissues separate, our abs separate on 100% of us. It's the variation comes in what happens postpartum.
Yeah. Okay. And so the pelvic floor exercises too, like this is another big thing we hear about, and this can lead to some other conditions too if we're not taking care of it. But what is happening? Everything just seems to kind of like fall out from underneath us.
The best analogy.
Kind of.
You're right, it's true.
Yeah.
Yes, kind of. So what happens is those pelvic floor muscles, think of any muscle in your body, has to stretch and expand to let a person through.
Yeah.
Right?
Yeah. Casual.
Right. And with that postpartum, something happens that's called muscle inhibition, which just means those muscles turn off and say, we're done. You did something really hard to us. We're not going to work. So what happens, and the same thing happens to the core actually. So what happens postpartum is we have to talk to those muscles and say, hey, wake up.
We need you to work again.
It doesn't just happen without a little bit of coaxing from us, which is why so many of us deal with these difficulties for a long time. Because as you said, no one told you to get it going.
Absolutely not. And why do you think that 6-week time frame seems to be the norm here? Because I remember I felt like it was too soon, but also I didn't know if it was too long, like if nothing happened, I'm good.
Right. I'm glad you asked that. I always say that 6 weeks is too long to have been doing nothing at all, but way too short to say you're good, do everything.
Right.
And when we look at that 6-week number, it really comes from the physician side of things, of being technically safe in terms of your tissues being healed and that you're not going to be bleeding out, for example, right? So we're looking for really, really high stress things that you're kind of clear for at 6 weeks, but the musculoskeletal part of it is certainly not all clear at 6 weeks.
One thing that you had mentioned to me too is that a lot of women don't know that you, like your insurance, for instance, might cover some of this stuff that's happening that you may need help for, or with like pelvic floor exercises and that sort of thing.
That's right. There are pelvic floor physical therapists all over Pittsburgh. There's cash-based, there's insurance-based. We are everywhere. We are like a mecca. We have a very high quantity of pelvic floor PTs in our area.
Oh, we love that.
We do love it.
And just to know that there's that kind of protection and there's that kind of, knowledge just at our fingertips in the city.
It's everywhere. The problem is we're not always referred. So unfortunately, I speak about it nonstop, and my patients ask for the help. And their providers are happy to give it to them. They just don't always think of it first.
And is there like a point where it's too late to seek help? Okay,
never, never.
All right, because I am 5 years postpartum, so I need a little bit of help in order to get it.